Hello everyone, my name is Sanjita Siddika Jesse. I am a student of Latrobe University. Currently, I am doing my Masters in Public Health and Masters in Health Administration under the subject of Social and Cultural Perspective. I am now doing a book review. The name of my book is The Spare Room. The name of the author is Helen Garner. Helen Garner was born in Geelong, Victoria on 7th November 1942. She is an Australian novelist, short story writer and journalist. She was graduated from University of Melbourne. She wrote both fiction and non-fiction. The Spare Room was published in 2008. It is Helen Garner's first work of fiction in 15 years. This book won awards like Victorian's Premier's Literary Awards, Vance Palmer Prize for Fiction 2008 winner, Queensland Premier's Literary Awards, Best Fiction Books 2008 winner, and also Barbara Jeffries Award 2009 winner. The book, The Spare Room, is a story of 3 difficult weeks between two friends, Helen and Nicola. Nicola is a cancer patient who was diagnosed wrongly with bowel cancer. Helen is a friend of Nicola for last 15 years who stays in Melbourne. The story begins with Helen, who is preparing the spare room for her friend Nicola. Nicola is coming to Melbourne for 3 weeks to attend an extensive alternative treatment in the Theodore Institute. She was convinced that after her 3 weeks treatment with high doses of vitamin C, she will be cured of cancer. After listening from Nicola about the treatment procedure, Helen was not convinced, but she just wanted to support her friend. When the therapy started, Nicola started to have some problems. She is complaining of severe weakness, heavy pain, and at night she woke up in the mid-sleep, and Helen also found her sweating profusely. One night it went so worse that Nicola urinated in her bed. As a good friend of Nicola, Helen took care of everything. She did not complain about anything anytime. She even forget her social life and other responsibilities and devoted her total time in serving her friend's need. At certain situation, she thought that she can no more handle it alone. She wanted to take some help from the palliative care service for Nicola, as it could help both. But because of Nicola's adamant behavior, she refuses to take it, which really hurt Helen's feeling. As the therapy progressed, one day Nicola's condition got worse that she cannot come home by herself, so the institute called Helen to take her. Helen was so angry with them not letting her know before, she decided to take Nicola to another doctor. But it was not easy for her to convince Nicola, as Nicola really believes that this therapy will help her fully cure cancer, even though she was going through a lot of pain. Finally, Helen took her to a doctor, Dr. Maloney. He suggested Helen get an MRI and bone scanning of Nicola. When the report comes, it was really shocking for Helen to hear that Nicola is having a tumor because of which her C7 vertebra is almost totally devoured. If the remain of the vertebra is not cut and replaced with metal, she will end up a quadriplegic as the tumor was processing to the spinal cord. Therefore, the doctor suggested her to undergo surgery. Though Nicola wants to get operated in Melbourne, Helen felt that she cannot alone manage the situation again. Hence, with much difficulty, she convinced Nicola to go Sydney and left her there, promising she will be with her during surgery. But unfortunately, Helen lost Nicola. From the author's point of view, she wants to show the friendship between two women. One is thoughtful and the other is stubbornly self-possessed. Because of this difference in thoughts during the Nicola's therapy, it went in an unmapped path. In that point of view, I totally agree with the author about the emotion, friendship, and the stages they face together. Although Nicola at some point is very arrogant and rude with Helen, she tried to support her friend till the end. The author also pointed that when a cancer patient searches for treatment to survive, sometimes the trust issue becomes their enemy. They trust anyone who tells them that will cure their cancer, which may end them in a false situation. My point of view totally agree with the author in this matter. Also, I strongly believe at some point while reading the book that a palliative care service is really a good option for a cancer patient. Palliative care is that part of healthcare that actually help people who has progressed illness which may lead to death. At a time, people do not look for cure. It is no longer the aim of the treatment. Maintenance of best possible way to survive these last days become their priority. This cancer treatment process is long, so it's difficult for the patient's family members and friends to manage the situation, as I can see that Helen has struggled with Nicola. This palliative care can help her to manage physical, emotional, and social need. Another point of view about this book is misdiagnosis, which I have mentioned earlier. Misdiagnosis of cancer leads to prolonging and over treatment. It affects a patient's chance of getting better. I think there is a need for precision and also a need for healthy information exchange. The health system should take steps to prevent the wrong diagnosis. Overall, I think it is a nice book. From this book, we can get emotional suffering of the patient and the people around them.